author of the book is a must-read, Demystifying Cancer. Okay, I read a little bit, just a couple of lines here. It says, this book, and what this book is intended to do, the book is intended to expose the facts surrounding the processes that cause cancer. And this information will give you understanding on how to avoid the disease. It will show how people have reversed and eliminated this disease without ever using surgery or drugs, such as the cell-damaging treatments of chemotherapy and radiotherapy, much favored by the cancer industry. It's absolutely amazing to have Devon here with me today, because a lot of us still don't quite understand what cancer is about. And there is another way, as Devon is just explaining here. We've got the complementary alternative way, which a lot of people don't know about. There is another way you can look at your health. It's a natural way, if you want to sum it up that way. And you've got the conventional way. So you've got the conventional way, which is the one we know, one's quite big. And we've got the natural way, okay, alternative, okay, naturopathic. That's what that's about. So having these two different ways of looking after your health, understanding what they're about. If you've been sick for a long time, it's time to look at a different way.
Yes,
because they complement each other, for goodness sake. We're not taking away from what you're used to, but it's tapping into something else to see if you can get help.
Yes, and the main thing is to take responsibility and don't leave everything to somebody else, because how do you know what is their motive? If every person is operating in their self-interest, and let us say the pharmaceutical industry, their self-interest is to make money. Mm-hmm. That is self-evident. They're a business. Business don't make money, they don't stay in business. So if that's their self-interest, that might clash with your self-interest, which I presume is to stay alive.
But a lot of people don't see, Devon. A lot of people don't see the cancer as a money-making industry. I mean, you talk about, just before the news, you were saying, look, for over 70 years, these guys have had the job. And now you're saying that by 2050...
No, for over 100 years they've had the job.
For over 100 years they've had the job. Thank you very much. So it's over 100 years you've had the job to help find a solution for cancer.
Yeah.
Okay? We're still saying we're working on it. We're running night and day. We're trying. Give us some more time. Oh my goodness. But by 2050, this thing will it will increase even more.
Right.
So how much more time you need? Right. And that is why we've got the book here, Demystifying Cancer, that Devon has written. He's the author of this book. Read it and see if the whole thing makes sense. No one is taking away from the compliment from the system that you're used to. We're just saying, when you go to see a doctor, and if you've been sick for a long time, we're talking about cancer here today, ask if you can be referred to see someone who does natural health, just to see if that can help you.
Well, that's not going to happen, because you have to have a license to treat people with cancer. So that's not going to happen. All I'm saying to people is that you are responsible, because if the system is there based on a combination of ignorance, because doctors are not bad people, that's what they're trained to do. You know, if you're trained to think in terms of going to the chemist and buy some prescription, that's what you're going to do, and you believe it to be right and ethical.
That makes sense.
I've always said, it's not like you're being a bad person.
That's right.
The point is, there's a thing that doctors take called the Hippocratic Oath, and I think that definition has been lost, because the Hippocratic Oath says that you swear not to do anything that will harm your patient. But chemotherapy is going against that ethic.
But not if
it harms the person.
But not if the person who's been trained, not if they see that as okay.
Yes, that's the point I'm saying to you. I'm saying to you that there is it's like people don't believe then if the thing is not harsh. The way the mindset is, if it's not something that's harsh, it's not medicine, it's not doing anything. While, for example, if you are ill and you gradually change your diet, you don't feel, it's not a situation where you're going to get in some side effect in a drastic way from doing that. So, but that can make you well. But with medicine, you get these serious side effects in many of these situations. And people are saying, well, that's the real medicine because that's how medicine is supposed to work. But the natural way says the body is a natural organism. It doesn't necessarily need something harsh inside of it. Furthermore, the body does two things to anything that enters it. The body is a very simple organism in some ways. It's either utilize it, like digest it, or try to expel it. That's what the body does. It either can digest it to use it, because what else does the body going to do with anything that comes inside? So if it cannot digest it, it tries to get rid of it. So for example, if somebody's, one of a bit of information I found in doing the research, they're saying, listen, they are suggesting that many people who get cancer and get treated don't die from cancer, they die from chemotherapy. Because the drug, which is a poison, chemotherapy is a poison because it kills, and that's not a secret, it kills good and bad cells.
Yeah, we know that's it kills
right,
good
so
and bad cells.
You have to be a poison.
So it's
to
weakening the immune system in the process.
So good cell and bad cell mean the cell, it doesn't matter where the cell is. Whether
everybody get wiped out.
Whether it's your liver, all the different organs that are supposed to defend you, like your liver, get damaged by this thing. Now, that is what it is. So they are saying it's okay to do that. That you take something that kills good cells and bad cells, and that's supposed to make you well. And you say, well, hold on a minute, but if I'm very ill, that's the time I need my good cells. I don't want to kill the good cells, I just want to... But then, to be fair to them, they are aware of this, and they are looking to work on finding ways to only target the cancer cells. So that would make a difference, but it still leaves them short, because if you kill the cancer cell, you still have not gone to the root of why your body become cancerous in the first place, which is what I've said earlier. The body's biochemistry have changed because of the person's diet and lifestyle. This is not something that has anything to do with the cancer industry in terms of what it's the pharmaceutical industry, which is the one that drive the treatment. So there's a distinction between the people who do the research and find the information. There's a distinction between them and the people who supplies the treatment. You understand what I'm saying to you? So you find out something, then you say, just like if you become a doctor, you go and train, and then you're trained to say, well, this is what you do and whatever. When a patient comes to you, you go to a manual to find out what is the latest approved drug. It has nothing to do with you personally as a doctor. All you do is diagnose what you think the problem is, and then you go to the manual supplied by who? The pharmaceutical industry, because they are the ones with enough money to do the research, and to bring a drug to the market would cost like $1 billion or something. So the system is set up whereby it's only the people with big money can research and bring drugs to the market, and they are the ones who, once the drug is approved by different bodies, then the doctor becomes like basically just a prescription writer. He's not really a doctor in the traditional sense, where he is saying, look, I've discovered what's wrong with you, let me go and find something to deal with this thing of my own knowledge. Because the research that goes into this drug wasn't his research. He's just basing what the system have approved this drug, so therefore this is the one I'm going to give you. And you go to him and he gives you this drug, and you might say, well, oh, there's a bad reaction. You go back to him and say, all right, try this one instead. It's a lottery. He's going through the motion to say, well, try this one, that one, the other one. That's the system as it is. And people have, what has made this thing dangerous is that this becomes the norm for people. For example, it's normal that you go and get a medicine for something for life, and you're going to take a medication for life. That's become normal. That should not be the case. That it's normal to be on drugs for life, and that become a norm. You know how much money I can make if I can supply you with something that you need to take for life. But real medicine, in my opinion, should have a cut-off point.
Yeah, eating your food as medicine, yeah?
Yes. Real medicine should have a cut-off point to say, well, after 2 or 3 years, I should be fine.
Yeah.
But that's not the way the system works that we sign up to. And my book is to provoke people to think about these things. And first and foremost, to be armed and recognize some of the stuff that, for example, one of the problems I have with the industry is their lack of educating the public. for example, if you look at the mandates for these cancer research organizations, they'll put on it, one is to inform the public.
Yes.
Then you check how much money do they spend on information to the public? Very little. Most of it is spent on research or whatever else. So it's all in a minute. So what is it they know that they should be telling the public and putting it on primetime television to make sure everybody hear it? Lo and behold, you go on the WHO website, the World Health Organization. They have a list of the common things that cause cancer. What is number 3 on their list? Alcohol consumption.
Alcohol consumption?
So it's all in a minute. So why is this not general knowledge? If they know this to be fact that drinking alcohol can cause cancer, why is that not broadcast on every prime time television there is? With all the billions that they collect every year, they can more than afford to do this. Why is that so quiet? Why do I have to go on a website, on their website, to find this out? And they are supposed to be in the public interest. They're supposed to be non-profit organizations. Why are they not broadcasting this stuff? So people need to think about these things. And as I said, the research is there that they have done. And then I've presented the research, and people to read those research and make up their own mind as to what they should or shouldn't do.
Well, that's clear cut, isn't it? You're saying that they're saying alcohol is another contributing factor to cancer.
They do them, they rank them, like 1, 2, like yes. Let's say smoking is number 1, then blah, 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 and then come to third.
But it's not on prime time television.
No, they're not advertising
it's not advertised enough for people.
No, compared to say smoking, for example, that they put it on package and all of that. You don't see it on bottles that alcohol cause cancer. As far as I'm aware, it's not on any bottle. And I'm saying this is the dangerous situation that we're in, where these people have information. I'm not saying that's going to stop people from drinking, because clearly, even on the package of cigarette, it doesn't stop people from smoking.
Not at all. No.
I'm just saying, in the interest of fairness and whatever else we want to put in there, justice or whatever, they ought to be doing their job and informing people, and let people decide if they still want to take that risk.
Yes.
Which most people will, I think.
Yes,
Because it's just something in us that drives us to do. If we are already addicted to a certain lifestyle, it's hard. My contention is give people that option of information to know this is what the consequence.
And the information should be coming thick and fast, yes? So people are reminded, because once we're locked into certain lifestyles, certain habits, we do need to be reminded, to be fair. You know, we get stressed and we get distracted. We need that regular information, that constant information. We need to be bombarded. We need it as a television advert. How about that?
Oh, yeah. They need to have documentaries on these things. They make documentaries about everything. Why are they not put this information? I'm saying the amount of information I find that is there. And as I said, some of this information is on their website.
Yes.
About the nature of the disease. Cancer Research UK, I found some very important information on their website. But where is that in the public domain? I've never seen it on television. And I'm just saying, what is this all about then?
And why do you think, for people who have just joining us, why do you think this information is about to do with cancer here, and there's not enough information to remind us that cancer is, we can address this using alternative health?
It seemed to me that the fear factor that surrounds cancer, nobody's trying to minimize the fear factor by removing the mystique of the cancer thing.
Yes.
For example, the very first research that was done, the first clinical trial, which was done by Dr. Warburg in 1924.
Yes.
Why is that not a documentary that's shown on television? They gave him a Nobel Prize for this. Why wouldn't they broadcast these findings that they have about the nature of cancer?
And why do you think that is?
Well, they're the best one to answer that question. All I'm saying is that, in my opinion, that would be helpful.
Yes.
If they made an attempt
because
to explain
if it's not, then one would think doubt.